What are my thoughts on the epino, or this, for example, is the animal? So these are perineal dilator devices. So the aim of the dilating devices are to try and stretch the perineum at the end of pregnancy to reduce the chance of tearing or episiotomies. So let's take a look at the evidence and the research, and I just want to highlight that I am not sponsored by either company. However, I do have my own experience which I will go through at the end of using the animal device myself. So let's start by looking at the evidence on the epino. Now, it's really important to say that whilst this is a systematic review of all of the available evidence, so there's multiple studies, the studies include a small amount of women in each. So it's worth noting that the research that we've got is based on a very small number of women. And the evidence on outcomes is mixed. There is some research that states that more women are likely to have an intact perineum after using the epino during pregnancy. For example, 46% of women in this particular trial had an intact perineum compared to 17%. Now, when we look at the overall statistics in the UK, around about 15% of women will have an intact perineum, more likely when you've had babies before as opposed to a first baby, for example. And in some of these research studies, they found that episiotomy was slightly lower as well with the epino device. Now, within these studies, there is a small chance of bias in the actual results because of the implementation of the device, but there is also differences in the management during labour and birth, particularly with the multi-centre ones that have undertaken, because actually some obstetricians will put their hands on, some will have them off. There's a whole debate in the midwifery and obstetric world as to whether hands on, hands off, hands poised, the types of technique that you use with your fingers, as to what outcome that has with the difference in perineal trauma. So actually, we need to think that it might not just be the epino that has impacted on these results, but actually that it might be the other confounding factors within the obstetric environment during labour and birth, the types of position women use, for example, whether it was hands on or hands off. None of that was accounted for within these research studies. Now, another outcome that they looked at was the pushing stage of labour, and one of the research studies found a shorter second stage, so that's the pushing stage of labour in the epino users, compared to women who did not. They also found that there was a lower chance of epidurals and also opioid use, so that's things like pethidine and diamorphine in the epino group compared to the non-epino group. It's about the risks. So they've done one study on 81 epino users and 64 controls. And what they found is that whilst there was no real differences in this particular study between episiotomy rate and perineal tears, there was a slightly higher chance in the epino users to have a levator ani avulsion compared to the women who did not use the epino. And this in particular is essentially like a weakness around the muscles of the pubic bone, predisposing women to prolapses later on in life. The chance in this small study was 12% versus 7% in the non-epino users. Now, in another trial with 335 women who used the epino and comparing it to 325 controls, they reported that there was no difference in terms of external anal sphincter function between the groups. So when they looked at this in a lot more detail, there was no difference between the groups. So at the moment, it is a mixed picture as to whether or not there are longer term risks of either using the epino or not. Now, what about the shorter term risks? So one of the biggest risks is that women think that they have to inflate this within their vagina up to 30 centimetres in order for it to have an effect. And anecdotally, I've heard of women entering the antenatal admission units who have had tears in the antenatal period from over-inflating this. And so it's really important that if you are going to use either the Aniball or the epino devices, that you actually listen to your body and that you only inflate it to a point where you are comfortable. Now, the other risk is infection, and it's really important that if you are going to use one of these devices that you clean it properly before and after using it, making sure that you are following the instructions released by the manufacturer to make sure that you are cleaning it adequately, because genital tract infection is a big risk in the antenatal but also the postnatal period, so it's really important to keep this clean. Now, in this study, they also discussed how likely a woman was to actually continue using it, and also the dilation that she would reach with the actual Aniball or the epino, for example. I would say just follow your body. Do not worry about figures. Do not worry about the centimetres that you are getting to. And the whole point of the epino or the aniball is for women who maybe are unable to do perineal massage, who don't feel comfortable to do perineal massage, who want to use a device instead. And that is entirely choice, and that is up to a woman to decide what is right for her. Now, the conclusions to this study is that actually it seems to be fairly safe if it is used appropriately with the right guidance and the right support and advice. And it might have positive effects in the future if we can do larger randomised control studies between women who use it and who do not, and then looking at the outcomes with very specific ways of controlling the environment that the woman is birthing in terms of hands-on, hands-off, so that we can account for the other factors that might reduce the chance of tears during her birth, for example. There is always the discussion, though, about why we are trying to stretch the perineum to prevent tears. Now, 85% of women will have tears during childbirth, and this is increasing with the increasing induction of labour rates, with bigger babies, and also with the positions that are adopted with things like epidurals as well, which again all increase the chance of tears for women. Increasing instrumental birth rates also increase the chance of episiotomies, but also third and fourth degree tears. Now, women's perineums are designed to stretch in normal, uncomplicated vaginal birth, and they usually go back together with no problems and no concerns and heal very well as a result, even with a tear. These devices obviously cost money, and they also have an environmental footprint as well to consider when you are thinking about whether or not you want to use it. Now, this is where my anecdotal experience comes in, and I personally use this. I used the aniball with my first baby. I birthed her directly back to back, so she came out in a back to back position as my first baby. I breathed her out with an epidural, okay, I didn't actively push with her, and she was born within about 30 minutes of me breathing her out in that sort of pushing stage, following my body. I had no tears, I had 0 tears, and I used it again with my second baby, and again 0 tears. Now, the reason I used it is because, one, I was scared of perineal trauma, and I wanted to do things that reduce my chance of perineal trauma. I've seen some long-term poor outcomes from any type of trauma that I wanted to do my best to prevent it, and so I wanted to try anything for that. And I couldn't reach for perineal massage. I didn't feel comfortable in having my husband perform that for me to try and reduce my chance of tearing. And I would always suggest that as a first port of call that women go down the perineal massage route wherever you can do first. 1, it's a lower environmental footprint. 2, it's cheaper. 3, there are no reports of any tears happening antenatally, and there's a lower chance of infection as a result. However, for someone like me who found it really difficult to actually be able to reach, this worked wonders for me. And I personally do feel that this did have the outcome that I wanted to, in terms of A, being able to birth my back-to-back baby with an epidural very quickly, B, not needing any instruments during the actual birth, and C, having an intact perineum both times. I haven't had any long-term problems So I've been lucky having had the aniball, and I personally feel it worked for me. However, as I've shown you, the evidence on epino and aniball, the perineal dilating devices, they are very mixed. And if you do decide to use the aniball or epino, please use it carefully. Please follow the instructions. Please do not overinflate it, and please clean it properly.